Hello guys, today we are at AV De Costa Hospital and we have come to meet Dr. Rudolf Vaz. Come, let's go. Hello everyone, welcome to today's VIEWBOX powered by Radiance Diagnostics. We all feel heartburn or acid reflux sometimes, but when does it become something serious? Today we have Dr. Rudolf Vaz, a gastrosurgeon, to explain GERD, that is Gastroesophageal Reflux Disease. He is an expert in advanced laparoscopic surgeries, especially surgery for GERD. By the end of this episode, you will also know everything you need to know about GERD, from causes to treatments. And we will also burst some of the myths. Welcome, Dr. Rudolf, to our podcast, The VIEWBOX.
Thank you, Asha, for inviting me to speak on GERD today. This is one of my favorite topics and it's very close to my heart.
So, Doctor, what exactly is acid reflux or GERD?
It is a gastroesophageal reflux, meaning the acid from the stomach, which is produced in the stomach, tends to come up into the food pipe, the esophagus, which causes irritation of the food pipe. It is due to a weak valve at the junction of the food pipe and the stomach.
Why does the stomach acid go up and cause heartburn in some people and not the others?
There are many anatomical abnormalities that can occur, and there are functional abnormalities that can occur why the acid goes up. Most common is a gastroesophageal valve complex. There are other mechanisms like the tilt of the esophagus, the muscle which surrounds the esophagus at the junction called the diaphragm, which allows it to, which causes a pinch-cock effect and does not allow that acid to come up. So when all those mechanisms fail, and there is a physiological valve as well, when all those mechanisms fail, then the valve becomes patellus and the acid comes up to the food pipe.
What happens if acid keeps on coming, doctor?
If acid keeps on coming, initially you will have just symptoms of heartburn, pain, irritation and things like that. But over a period of time, it can have complications. Like over many years, you can get esophageal cancer. That is a long-term complication. In the short-term complication, it can cause irritation of the food pipe, ulcers, esophagitis, can cause irritation of the airways, can cause irritation of the throat, including a bad breath, bad taste, and altered sensations.
Is GERD common and among whom and why, sir?
GERD is common mostly in the middle age group. But we have seen GERD right from childhood as well as elderly patients. And these elderly patients are usually not diagnosed as GERD. They go to a physician who treats them for their cough. They go to an ENT who treats them for a long time for their throat problems and things like that. And they miss out on the GERD, which is the cause of this irritation.
And can you get GERD without heartburn?
Yes, there is silent GERD which you can get, and that may not cause heartburn. Another class of patients are those who have had GERD for a long time. Initially, they have heartburn, but over a period of time, when the esophagus changes into a pre-malignant condition like a Barrett's esophagus and things like that, that time the symptoms come down, but the disease process continues.
Okay, and finally, when should I see a doctor, sir?
See, when you are having the symptoms for more than, say, a week or 2 weeks, it irritates you, it alters your lifestyle and causes problems in your day-to-day living or disturbs your sleep. Many patients come with disturbed sleep and cough at night. Okay, those are the times when you need to investigate whether you have GERD.
Are all chest pain GERD? And how do we know if the chest pain is due to acid reflux or heart attack? We see many people taking heart attack for acid reflux.
So whenever a patient comes with this acid reflux and GERD type of symptoms, we do a thorough evaluation of the patient. So that means we rule out heart problems with an ECG, with a physician reference. We also look for other causes, like say if does the patient consume alcohol, could it be pancreatitis, could it be just ulcer problems in the stomach because of eating only spicy food, or could it there be some resident bacteria in the stomach that is causing these symptoms. Okay, so it could be also a bit of a lung infection that can cause similar pains. Of course, angina that means related to the heart needs to be ruled out, and sometimes those symptoms are very atypical. Inferior wall MI presents as pain in the epigastrium, in the upper part of the this abdomen, but it may not present as chest pain at all. In those type of patients, also we need to keep our eyes open for various diagnoses and rule out depending on the patient's symptoms, and the duration, and how the patient presents.
Does obesity make it worse?
Obesity is one of the risk factors. It increases the pressure on the diaphragm, on the food pipe. Second thing is, because of the obesity, the patients generally tend to eat much more, and things like that. That causes over distension of the stomach, and that can weaken the valve over a period of time.
And doctor, can pregnancy increase the risk or can cause acid reflux?
Pregnancy is a temporary increased abdominal pressure. So yes, anything that increases the abdominal pressure can increase the risk of GERD.
Okay. Do some medicines trigger GERD? Because I often see doctors recommending tablets to be taken on full stomach, and they also prescribe some antacids along with some painkillers and aspirins.
Most of these medications, when taken for a long term, irritate the lining of the stomach. Common medications are the aspirins, as you rightly said, then painkillers, hypertensive medications, certain medications like oral contraceptive pills. All these irritate the lining of the stomach. There are certain other medications like chemo medications and all also, which cause damage to the lining of the stomach and the food pipe, and increase the acid production, and that itself can cause GERD. So always we do prescribe PPIs, that is anti-acid medication, for those patients who are likely to have increased acid production or irritation because of the medication. Even the treatment of H. pylori, for example, is a treatment which is a resident in the stomach. Along with that, we have to give a long course of PPIs for that.
Sir, normally, like when we get even cold and all, sometimes they prescribe, doctors give us medicine, no, like antibiotics and all. With that also, they give us the same. No?
Yes, for the same reason, antibiotics also irritate the stomach, and we do give PPIs for the same reason.
How does doctor decide if it is GERD, and what test do you often recommend?
See, initially we treat depending on the duration of the symptoms. The patient comes with a duration of a few days, say for example, just 4 or 5 days. We treat the patients with appropriate doses, appropriate advice on the timing of the doses, how to take the medications for a certain period of time. If they do not respond to the medications, that is when we suspect, okay, this is a GERD, and this is when we need to investigate further. So in these patients, then the first choice of investigation would be an upper GI endoscopy.
What is endoscopy, sir, and why it is so important?
Yeah, so endoscopy is a procedure done by a gastroenterologist who puts in a camera through your mouth and checks the food pipe, checks the valve, stomach, and the first part of the intestine. In this, he can give us very important information as per the laxity of the valve, whether there is a hiatus hernia, whether there is ulcers in the stomach, whether there is, he takes a piece of the stomach and sends it for testing for H. pylori, and that can tell us whether the patient requires treatment for H. pylori. And sometimes you can even have other problems like stricture of the food pipe, or even a cancer can be detected through the endoscopy. So all patients with GERD, especially above the age of 50, You should not just neglect and just put on medicines. It is always better to get an endoscopy.
Endoscopy. They take some tissue samples during endoscopy.
Yeah,
So,
they take
why is
it.
it?
That is for H. pylori. They take for testing for whether you have bacteria. Also, and as well for biopsy for any suspicious lesions for if you to rule out malignancy, cancer, those type of things.
Sir, is this endoscopy painful?
Endoscopy is a small procedure and it is usually done under mild sedation wherein the patient is calmed and relaxed during the procedure, and so the patient may not have any pain or discomfort during the procedure. Okay, there are times when it is done without sedation. It can be a bit of a discomfort for the patient, but generally if you do it under sedation, the patients are absolutely fine.
Okay. How do you know if GERD is serious?
GERD is serious if depending on the type of GERD, the type of symptoms. There are too much reflux, that means lot of acid coming up, lot of volume, that means along with that food also comes up. Okay, the patient has complications of GERD, like on endoscopy, something called as a Barrett's esophagus, wherein the lining of the food pipe changes to a different type of lining, which can turn into cancer. Okay, so it is a pre-malignant condition. Then if there are complications of GERD, like the patient has sometimes lung infections and pneumonia, bronchitis because of GERD, throat becomes inflamed, okay, and there is bad taste of the mouth. Patient can have discoloration of the teeth. So all these complications, when they have, that the patient has serious GERD. So during our examination, we also look for all these things, take a detailed history of all these related problems
so
that the patient could have, so that we know we are not only dealing with this simple GERD, but whether we are dealing with GERD with its complications.
Okay. Can GERD go away on its own?
GERD can be controlled by lifestyle and modifications as well as diet. But once you have an anatomical problem like a loose valve, or you have a hiatus hernia, okay, or you have something like a defect in the diaphragm, that the muscle which separates the chest from the abdomen. In those cases, the GERD will continue to persist for a long time. Okay, so there are certain things where only this is a functional type of problem, wherein the patient maybe had a very heavy meal or went for a party and had some alcohol and with in that episode. So those type of patients, if 1 or 2 episodes of those happen, those can be controlled with medications, and those patients usually do not progress to GERD. But when you have an anatomical problem, then definitely the GERD is going to trouble you and you need to do something about it.
Can small lifestyle changes help?
Yes. Certain lifestyle changes like smaller meals, eating smaller meals, eating less spicy food, less oily food, avoiding too much alcohol, avoiding too much coffee and tea, all those things can help you to control. Other thing is maybe your posture, erect posture. Immediately after eating, do not go to sleep. The head end should be elevated. Okay, so all those lifestyle modifications can help you.
Okay. Which food should I avoid, sir?
So main culprit foods are spicy food, deep fried food, and certain, like I said, alcohol, smoking, tea, excess of tea and coffee. Those relax the valve. They all can cause worsen GERD.
So tea, coffee we can take twice a day, like that. Like what is the minimum?
Yeah, once or twice a day is fine if you are not having GERD. But once you have GERD, it is better to avoid.
Not even once we can take.
Maybe once a day, but not frequently, not more than that.
Okay, does exercise help in relieving acid reflux or heartburn? Many people have habit of walking soon after the meals. Should it be like that? So just you said that we should not go to sleep after having. That will help.
Yeah, exercise is very important to control your weight, okay, to prevent the reflux by anti-gravity and as well as by ensuring that the acid does not come up during that time.
And what about stress, sir?
Yeah.
Stress can worsen reflux?
Yeah, so stress can worsen reflux because stress, there is a brain-gut axis. So the brain stimulation can cause increased acidity, increased negative hormones, which increase the acidity, and that can worsen reflux.
Okay. Do antacids cure GERD? Because I see many people take antacids as and when required, and self-medication is safe, sir?
Hey, coming to your first question, antacids do not cure GERD. Antacids only reduce the acid production or neutralize the acid. Okay, so beyond that, antacids do not have a role. Say your second question is
Self-medication.
self-medication. See, it
Whether
is
it's
always
safe.
dangerous to self-medicate because you do not take the appropriate dose. You do not take the appropriate drug for what you are having, and you may not require that particular medication at all. So self-medication is always dangerous. So we advise all patients not to self-medicate, to take professional advice before starting any medication.
Do all patients diagnosed with GERD need medication?
Uh, all patients diagnosed with GERD depends on the severity again and the duration of GERD. If the GERD is the symptoms of short duration, maybe a short course of antacids or PPIs should be enough for the patient.
Can medicines replace surgery?
Medicines can control the reflux for a certain amount of time, but beyond that, medicines have their limitations. One is they do not work for 24 hours. Second thing is the medicines, the same dose which is working today may not work after a month, after 2 months, or after some time. And over a period of time, what happens is that these medications do have their side effects. Do they have a deleterious effects on the
If they take it for a long
if
term.
they take it for a long time? Of course, if there is no option, then we are sometimes forced to give patients, especially very elderly patients who are not fit for surgery and they have this, then they are on those medications for a longer time. But generally, we do not want to give these type of medications for more than 2 or 3 months.
Okay, so that time you will suggest for
Yes,
surgery.
if the patient requires it for a longer time, then it is better to undergo surgery because surgery offers them a option for a cure, an option of a much better control with less side effects.
How long does this treatment take?
If we start on medications, we usually give initially for 2 weeks. Okay, patient is doing better, patient is responding well, we continue maybe for another 2 weeks. And by then the patient should be completely asymptomatic. The symptoms should be completely controlled. Okay. Now, if they have H. pylori, you have to treat them for H. pylori. That is 2 weeks treatment plus another 6 weeks of anti-acidity medication.
Okay.
Yeah. Now, if after 2 weeks, if they respond, but maybe in a month or 2 months they get the symptoms again, then those patients are going to have problems and we need to investigate further, like an endoscopy for further investigations.
When is surgery needed, sir?
So surgery, like I said, is selected for a few patients who do not respond to the medicines or who have responded initially to the medicines and then afterwards, once the medicines have stopped, they have got the symptoms again. Okay, to those patients who have something called as a hiatus hernia, when the opening of the diaphragm becomes lax and part of the food pipe and stomach comes into the chest. And those patients who have very lax sphincter, those patients who have already complications of GERD like Barrett's esophagus, and those patients who are having other complications like bronchitis or pneumonia or recurrent throat infections because of the triggers of the acid. So those patients would require surgery.
What is actually done in a surgery?
So we do a keyhole surgery called as a laparoscopic fundoplication. Okay, so in that what we do is we tighten the opening of the diaphragm through which the food pipe comes. We bring down the food pipe at least around 4 to 5 centimeters into the stomach and wrap the upper part of the stomach around the food pipe, hugging the food pipe to fix it over there, as well as it creates like a bogey type of a valve effect. So it prevents the acid from coming out.
With recent advancement in surgery, are there minimally invasive options, and how are they different, and what are the advantages of it?
There are newly experimented options like endoscopic, this fundoplication and things like that, but they do not have the standard results and they do not have a really long follow-up. So they are still in investigative phase, and we do not know how much the patients benefit from that.
Is surgery a permanent cure?
Surgery offers a chance for a permanent cure. Okay, so having said that, the patient selection for surgery is very important. For example, out of 10 patients I see for GERD, maybe only 2 of them would be needing surgery. So the selection of these patients is very important for surgery. So appropriate selection of the patient ensures that the patient gets optimal results and cure.
Are there any risks, sir?
The risks are of any normal surgery. The risks are there of anesthesia and the risks of surgery. In surgery, we can have a bit of bleeding, we can have a little bit of wound infections and things like that. But all those things are tackled during the surgery, so to ensure that everything is fine during the surgery.
Can acid reflux keep coming back even after surgery?
It is very rare for acid reflux to come back, but again, in certain type of patients, especially the elderly patients, instead of doing a complete wrap, that means I told you the stomach, upper part of the stomach is wrapped around the food pipe, we do not wrap it completely. We wrap only the back part of the food pipe for the stomach. So those patients can have a partial reflux, but they have much better control than what they had earlier. The reason why we do a partial wrap in those type of patients is because their food pipe tone is not too good. So they should not have obstruction. That means the food should be able to pass down freely, but the acid should not come up back again.
Okay. This is for older patients?
For the older patients.
So doctor, now let's bust some of the common myths. You can just say true or false and give us one line of explanation on each of them. Yeah?
Yes.
Coffee or tea increase risk of acid reflux?
True. Yes, coffee and tea, when taken in excess quantity, they can loosen the valve.
GERD is left untreated for long term can cause cancer.
Yes, it is true. The food pipe cancer, initially it can cause something called as a Barrett's esophagus, and later on it can cause cancer of the esophagus.
Children cannot have GERD.
False. Although it is less in children, but children do have the GERD. The youngest patient I operated for GERD having severe reflux was just 14 years.
Stress causes or rather increases acid reflux.
True, partially true. Stress increases the acid production and increases the, because of the increased production, it can come up and cause reflux.
Spicy foods always bad and should be generally be avoided.
True, spicy foods do increase the reflux.
In cases where surgery is not indicated, lifelong medication treatment is needed.
False.
So there is no lifelong medication needed?
No, lifelong, you cannot recommend lifelong medication for anybody for GERD.
As you said, starting 2 weeks.
Yeah, 2 weeks or a little longer you can go, but not lifelong.
GERD can affect your sleep?
Yes, GERD can disturb the sleep. It can cause you chronic cough. It can cause you burning sensation. It can cause you chest pain in the middle of the night. It can disturb sleep very badly. And this is one of the common complaints I get from patients.
Doctor, any takeaway message you would like to give to our audience?
Yes, GERD is more common than we think. GERD tends to cause a lot of other symptoms rather than just a reflux. It can cause irritation of the food pipe. It can cause chest pain. It can cause burning sensation in the throat as well as in a chronic cough. And there are complications of GERD which cannot be ignored. These complications can even be cancer if GERD is there for a long time. So the basic take-home message is do not neglect this acid reflux as just acidity or something like that. There could be something more serious underlying problem which needs to be investigated.
Thank you, Dr. Rudolf, for clearing up this common health issue of acid reflux or GERD in simple terms. Remember, awareness and early action save your esophagus and health. Don't ignore heartburn. That's all on ViewBox today. Like, share, comment with your questions, and we will cover them in our next episode. Till then, take care. Goodbye.